Hi, my name is Samantha Pulliam. I'm the Specialty Accreditation Director here at Stony Brook Southampton Hospital. Southampton is a primary stroke center here on Eastern Long Island. That means that we provide the best care possible for our patients in an expedited fashion. There are three major types of strokes, but essentially a stroke is a blockage or a rupture of a blood vessel which cuts off the oxygen and nutrients to the brain, which can lead to lasting damage. It's a medical emergency. And there are three types. You have an ischemic stroke, a hemorrhagic stroke, and a TIA. An ischemic stroke is the most common type of stroke. This happens when there's a blockage in the brain, which leads to a decrease in oxygen and nutrients to the brain. A hemorrhagic stroke is when there's a rupture in the vessels, which causes bleeding in the brain, which increases the pressure, cutting off the nutrients and oxygen to the brain. And a TIA, it's our body's way of saying, hey, let's take a pause, figure out what's going on before something more dangerous happens. There are a lot of risk factors for strokes, including mini strokes. There are modifiable and non-modifiable risk factors. Modifiable risk factors include high blood pressure, high cholesterol, obesity. Non-modifiable risk factors include age, sex, gender, race, and genetics. So as you get older, you are at more increased risk of stroke. However, in 2023, 38% of strokes were in people less than 65 years of age. So anyone can experience a stroke. However, the longer we live, the more likely we are to have a stroke. So symptoms of a stroke include weakness, dizziness, changes in speech, changes in vision, any kind of sensation or motor loss in one side of the body or the other. This can come across as asymmetry in the smile. It can come across in weakness in an arm or a leg. It also could come across as a pounding headache. This could be an indication of a hemorrhagic stroke. Any kind of change in mental status is also an indication. If you or someone you know is experiencing symptoms of a stroke, immediately call 911 and get to your nearest hospital. This is a medical emergency. You must be seen as soon as possible. There are amazing things that we can do nowadays to treat stroke. However, we have a strict time frame. There are medications that we can give to reverse ischemic strokes and TIAs if required. However, we have a 4.5 window of start of symptoms to use that. It is absolutely possible for a person to recover from a stroke. It just depends on the severity of the stroke. There are a lot of modalities that are put in place nowadays that can help people recover from stroke, such as PT, OT. We have amazing people here that will help you in your rehabilitation. We also offer a stroke support community because it is just as important for our mental health as it is for our physical health. If you've had a stroke, it is highly recommended that you make the modifications and recommendations that your providers give you. There's a 1 in 4 risk of a person having a second stroke after they've had their first stroke. So it is critical that you follow the advice of your medical professionals. To be able to prevent the risk of having a stroke, you can decrease your blood pressure, you can work out, you can eat healthy, eat the rainbow. I know everyone says it, but it is really, really important. Stop smoking. It is 2025. Nobody should be smoking cigarettes anymore, but it also includes vaping. You really shouldn't be putting anything in your lungs except for oxygen. So it's really important that you cut back on those things. Excessive alcohol consumption is also a leading factor of stroke. So you want to make sure that you cut down the number of drinks that you're having, and please make sure that you're taking the medications that are prescribed by your doctor.